I will now hand off the rest of this presentation to Alyssa Leon Martinez.
Thank you, Cassie. My name is Alyssa Leon Martinez. I'm a graduate student at Houston Christian University. I'll be doing my role play as CBT, and Cassie shall be my client. All right. My name is Alyssa Leon Martinez. I'm a student counselor. I would like to record this session for you and for the use of this class. Are you okay with that, Cassie?
Yes, I am.
I'd like for you to know that my video session is secure and your privacy will be respected. Before we get started, are you in a safe, secure location?
Yeah, I am.
All right. I'm going to use the CBT approach for this session. I would like to explain to you how this approach manages your problems by changing the way you think and behave. It's mostly used to treat anxiety and depression, but it could be useful for other mental and physical health problems. So, now what brings you in today?
All right. Well, my name is Cassie and I'm 42 years old. I recently had hip surgery a month ago and I feel like I'm unable to really do anything. I rely on my children to take care of me. I feel down and hopeless. I even stopped going to physical therapy because I just want to lay in bed all day. I just can't do the things I used to do without asking for help. I know I should because, I'm always independent, but now that I'm dependent on others, I just feel like I'm a burden onto them.
Oh, I'm so sorry to hear that, Cassie. So I want you to stop for a moment and pay attention to your thoughts. I've noticed that you keep saying should and must in your sentences. So what evidence do you have to support your predictions that you are a burden to your family, Cassie?
Well, I don't want to ask my kids to take me there because therapy is every morning. And, even though they work from home, they still have to take time off to take me there. And they're probably annoyed that they have to do that. And I feel anxious when I even have to ask them to bring me a glass of water. Before my surgery, I was so active. I used to go hiking and I used to go swimming almost every day, but now I can't.
You're telling yourself that you're a bother to your family? Do you think your family is annoyed by them taking you to physical therapy? Like, what do you mean when you say they are bothered when they help you? Like, can you give an example?
Well, whenever I asked them for help, sometimes I would hear them sigh, or whenever I needed help to go to the restroom, I feel like they're taking a long time to come to my room to help me. Just the other day, I just wanted my blinds open. I called out for my son, and it felt like it was hours before he came into my room to open them.
You think by them sighing and them taking a long time to help you seems as though you are a bother to them? Like, what do you mean when you feel hopeless?
I just feel like I can't do the same things I used to do. I feel like this surgery is affecting me and I can't do anything. It's hopeless. When the pain gets so intense, it reminds me that I can't do anything on my own.
So when you hear all these negative thoughts in your mind or say them out loud, like allow yourself to cancel out all that negativity. So dispute the negative statements and replace it with a statement that supports how you want to feel and think about yourself. Like think about any type of positive like statements. Tell me some of the things that keep you stuck in these negative feelings that you keep feeling.
Well, I say my family doesn't like me, that I'm a burden, that they see me as useless. And, actually, I've never really asked them how they felt about me always asking them for help. I just never really talked about it.
So what can you do differently in your home with your family that makes help, like that might help reduce your depression?
Well, I guess I could do a family meeting in my home and ask everyone how they feel about me, since I had the surgery. And I really do. I want to be motivated again. I want to get better. And I just want the support of my family.
So you stated earlier when your pain gets intense, it reminds you that you can't do anything. Like, why exactly do you feel this way?
Sometimes I have the motivation to get out of bed on my own, but the pain can get so bad that it completely stops me. And then after my motivation disappears, I just get really sad again.
So when you start to feel pain when you're trying to do things on your own, I just want you to breathe deeply and inhale through your nose and then exhale through your mouth. So I want you to take a step back. So I want you to breathe in deeply. And inhale through your nose and exhale through your mouth. Now, this time as you inhale, I want you to imagine a scene that's appealing and relaxing to you. So you said you like hiking, swimming. So as you breathe in, think about hiking or swimming or any memorial events. So, ready? Take a deep breath. Think about hiking, swimming, whatever that you like, and exhale. So I want to tell you the important thing about practicing this is a guided imagery and that you imagine enough detail to really take you into a place of relaxation. So when you start to feel this intense pain, I want you to take a moment and take a deep breath and think about what you love the most and exhale. So it can also take a while to recover from surgery, which I understand. And it's good to know that you're trying to move on your own. So let's agree on some homework for this week. When you feel like you are bothered to your family, unmotivated, or sad, see if you can alternate your thoughts into facts and positivity. So I would like for you to create a thought record diary. So in this thought record diary, what you're gonna do is you're gonna document the date, the situation that happened, and the automatic thoughts that come into your mind, as well the emotional reaction. Like, are you feeling angry? Are you feeling sad? And I also want you to describe your behavior. So throughout all that, I also want you to alternate your thoughts.
Okay. Maybe I could keep a record of the situations that give me negative thoughts.
So you stated that you aren't as motivated as before. So I would like for you to schedule positive activities as well. So since you aren't attending physical therapy no more, try to let your home be your walkway. So for example, you said you enjoyed hiking. So we'll take the first step by planning a day to walk to your bedroom door. And then the next day, plan a day to walk to your kitchen. So of course, with the like supervisor of your family for safety reasons, because you had surgery. So, and then schedule another day where you walk into the front door. So all this is going to bring you positivity and help you increase your mood.
Okay. Yeah, I think I can do that. I guess I can take time and schedule it throughout my day.
Well, I'm glad that you're willing to try, Cassie. These positive activities will slowly bring back your motivation and increase your mood because you're gaining back your independence slowly. So staying in bed isn't going to really help you get better. So, and let's see how your family feels in regards to helping you get better. We will continue with our sessions, of course, and discuss your homework and evaluate the responses from your family and see how it's impacted you.
All right. Thank you so much for this, Alyssa. I guess I'll see you next week.
Well, thank you, Cassie. And this is Alyssa and Cassie's presentation. So this concludes the counseling role play therapy. Thank you.
Thank you.
This concludes me and Cassie's counseling role play therapy, and we would like to thank you for watching. And yeah.
Thank you.